Hello, everyone. Thank you very much. So today I'll be talking about a specifically designed solution for vasospasm. So this is a stent retriever that's been designed for vasospasm, and this is just an example of how it looks, the working lengths and the full length. And of course, since we have 5 minutes, I'm going to go into the meat of things. The biggest thing you need if you want to treat vasospasm with a stent retriever, and data on this has been published for 4 or 5 years. It was presented in Val d'Isere 5 or 6 years ago. The key is radial force. And I think with something like a Solitaire 440 in a 2 millimeter vessel, which actually has more radial force than a 640 in a 2 millimeter vessel, that has almost a third of the force of the NeVa VS. So there really is, okay, you guys hear me? Okay. There really is a big difference in radial force. So they did the VITAL study, and they did a very good mix of vessels treated, 58% MCA, which is probably the most common we all treat in our practices. They had 95 deployments, an average of 1.3 deployments per vessel. So I think the biggest thing that I really enjoyed reading this study was percent of vessels requiring no further treatment. And I think that's really a big deal. In our practice, right, we try verapamil. If it doesn't work, we go to intracranial angioplasty. 93% of patients needed no further treatment. And if you look at the before and after stenosis, 65% was the average initial stenosis, with 29% after. Now, here's another key thing. No vessel ruptures or dissections. Now, there were 2 patients, so 93% didn't have anything done afterwards. 7% did. Some of those patients had angioplasty. 2 of those ruptured post-angioplasty. And I'm sure if you guys have a busy subarachnoid hemorrhage practice, a lot of vasospasm, and if you treat with angioplasty balloons, I'm sure you've seen this. So to me, this was even more of a sign that we shouldn't be doing angioplasty anymore. They had 3 documented thrombotic events. In the initial part of the study, they did not heparinize. I highly recommend you all in the room to heparinize. So we heparinized all these cases, and afterwards, after the initial part of the study, they also started doing that. So it's a safe strategy to regain vessel diameter. Here's an example of a patient with severe stenosis, severe vasospasm in the M1, and was treated with the device. And of course, high yield bullet points, right? Controlled vessel expansion, maintenance of distal flow. While this thing is deployed for a few minutes, you're infusing verapamil, and you're not occluding anything. And then, of course, reduced risk of vessel rupture. They had no vessel ruptures in the study. So far, it's a limited commercialization throughout the US, 12 cases known to date. 7 were done at Wellstar with Dr. Rishi Gupta. This was his first case. So first case, he basically is quoting saying a safer, more definitive alternative to balloon. And as you can see in the 3D reconstructions there, significant improvement in the vasospasm in a subarachnoid hemorrhage patient. Here's a 54-year-old female, clipping of a right ruptured MCA. As you can see here, severe vasospasm. He uses a Trevo 18. This patient got full dose anticoagulation. And as you'll see here, just to discuss a little bit of the technique. So you deploy the device, you leave it open for a few minutes, infuse your intraarterial vasodilator of your choice, right? I use verapamil. I know Raul uses milrinone, I believe, and whatever you like in your shop. So then you keep it up for a few minutes and then resheath it. Don't drag it out. That's extremely important. So they leave the device up for 2 to 3 minutes and intraarterial verapamil infusion through the guide catheter. They also treated, here you could see in a single shot of the vessel completely open. And then they also treated that proximal supraclinoid, paraclinoid segment with a second pass. And that's basically what they're doing here. They're going to resheath and then pull back. And this is the single shot of the supraclinoid segment. So here's the follow-up run. And it really is one of the first tools, first FDA approval of a device for intracranial vasospasm treatment with a stent retriever. You can, for those in the US, you can bill it like an angioplasty, maintaining flow, 93% of vessels, no further treatment, easy to use, no ruptures, no dissections. I really think that is the key point here, the key part of the message, 86% procedural success.